All right, we have information coming in. The Indian Council of Medical Research has detected 2 cases of human metapneumovirus or HMPV in Karnataka through routine surveillance. Surveillance system is robust, says the government of India. There is no unusual surge in ILI or SARI cases, which is influenza-like illness cases in the country. The details of the cases of the HMPV virus is as follows, but I'd like to tell our viewers about the fact that the government has also clarified that these aren't the first cases detected. HMPV has been in circulation in India, like in many other countries, for years together now. The 3-month-old baby who was diagnosed with HMPV after being admitted to the Baptist Hospital in Bengaluru had a history of this pneumonia. She's been since discharged, which is great news, which means the child has recuperated. An 8-month-old male infant, again a baby, who tested positive for HMPV on January 3rd, 2025, again in the same hospital, also is recovering, is what we know. Both these patients have no history of international travel, clarifies the government of India in a statement that I just read out for our viewers. Now, after COVID-19, the HMPV or human metapneumovirus has been reported. It started from China. Social media posts talking about the fact that hospitals and cemeteries are overwhelmed with virus patients. Speculations grow around its symptoms, prevention. Here's a report explaining everything about the mysterious virus spreading in China.
These are in pictures from the COVID-19 pandemic that broke out 5 years ago. Recent pictures from China that has surfaced on social media has sparked up big concerns about a possible spread of yet another infection. Overpacked hospitals and crematoriums overflowing is what various handles of social media indicate, but not the World Health Organization, neither China, has verified any of these claims. It is being suggested that mysterious metapneumovirus is making hundreds of people sick. China is indeed seeing a rise in respiratory infections. This is being attributed to the catch-up period with lockdowns opening up, exposure for pathogens and the winter season.
HMPV virus. This is a virus which is currently spreading in the northern provinces of China. It spreads by person-to-person contact and it also spreads if you get in touch with an infected person or you touch surfaces which are infected with the secretions like doorknobs, or if you shake hands, or if you touch surfaces which are infected with the virus.
The fact is that in any influenza, in any viral infection, the vulnerable will continue to be the senior citizens, the comorbid and children. This again is no different. But questions remain on why and how, and if at all China once again is covering up the facts. Whatever it is, it brings back a horrible sense of deja vu, given that around this time of the year is when the COVID-19 pandemic had raised its ugly head from Wuhan in China. In New Delhi, Sneha Mordani for India Today TV.